Meeting of the committee will come to order. The chair will start with an opening statement, and the ranking member will be given 5 minutes as well for an opening statement, and we will then have opening statements of 2 minutes by the other members of the committee. This is a historic day in the fight against tobacco, but it has taken us far too long to get here. I first introduced this legislation over 10 years ago and have fought every year since then. Would you put 5 minutes on the clock? Then to see it become law. We came close last year when the House passed this legislation by a vote of more than 3-1. Despite that overwhelming support, the bill did not become law, so we are back here again. I am hopeful, forget it then. Okay. I am hopeful that this year will mark the end of this long road and the beginning of a great strides in protecting our children from tobacco. All of us here share the goal of reducing the death and disease caused by tobacco. Tobacco is the leading preventable cause of death in our country, and every one of us has seen the devastating effects of tobacco, whether through losing someone we love, watching others grow sick, or even feeling the grip of nicotine addiction firsthand. Worst of all is watching our children and grandchildren targeted as the next wave of casualties. Regulating tobacco is the single most important thing we can do right now to curb the deadly toll of tobacco, and FDA is the right agency to do this job. In fact, FDA is the only agency with the right combination of scientific expertise, regulatory experience, and public health mission to effectively oversee these products. This bill will give FDA the authority to prevent the dangerous and all too prevalent marketing and sales of tobacco to kids. It will empower FDA to prevent tobacco companies from making false and misleading claims about their products. And it will give FDA the ability to require changes to product content or design to protect the public health. Some believe this legislation will serve only to distract FDA from its core mission. They say FDA is already facing an almost insurmountable challenge just managing its current workload. I share the concern about FDA's current ability to fulfill its mission, but it's clear to me that FDA's recent struggles are primarily a result of years of chronic underfunding. That's a failure in which both Congress and the last administration played a part. But this unfortunate state of affairs does not mean FDA cannot and should not take on the critical role of protecting the country against the harms of tobacco. It simply means that when we give the agency this additional responsibility, we also must give it the resources necessary to handle the job and to handle it well. We have ensured that this will happen under this legislation. The tobacco program will be fully funded through new users' fees paid for by the industry. We've carefully crafted the legislation to ensure that the monies received from those user fees will be directed exclusively to the Tobacco Center. And we've ensured that the amount of user fees will be enough to permit FDA to effectively take on this task. So the new tobacco program at FDA will not impact the other programs at the agency. It will not affect the work the agency is doing in the areas of food, drug, or device regulation, but it will give FDA authority to address one of the most significant public health issues in this country. Simply put, the bill meets the twin goals of assuring adequate funding for the tobacco program and protecting FDA's ability to fulfill its other critically important responsibilities. In short, we have everything we need to take this historic step: a comprehensive and flexible set of new authorities, a full certain funding, and all we need now is the political will to do the right thing. I'm hopeful that we have that too. This bill draws wide bipartisan support from all corners of the country. The breadth of support for this bill, from AARP to the American Academy of Pediatrics, from the Islamic Society of North America to the Southern Baptist Convention, just shows how critical this issue is to all Americans. I also want to note that we have worked hard to communicate specific concerns. We've heard about the bill. The bill that we will have before us today is identical in all substantive respects to what we passed by the House last year. In that bill, we made changes to ensure fairness and flexibility for convenience stores, tobacco growers, and small manufacturers. We've added provisions to ensure that FDA addresses the issue of menthol in cigarettes as one of its first priorities, and we also worked with the minority to address many of their concerns. I'm proud to have that we have reached this day. I look forward to taking this step toward protecting our children from the deadly tobacco epidemic. We'll be marking up some important public health bills that address issues from hearing to postpartum depression to the healthcare workforce. These bills all passed the House under suspension last year, and I hope to move them expeditiously as possible. I want at this time to yield to Mr. Deal for an opening statement.
Mr. Chairman, I would ask if you would recognize Mr. Boyer, who has a speaking engagement. Would you recognize him first?
Mr. Boyer, recognize you now for 2 minutes.
Thank you, Mr. Chairman. Today is a pivotal moment, I believe, for the public health of our country. And, Mr. Chairman, I want to compliment you on the sincerity and your perseverance with regard to working on this issue. Although we work without the benefit of hearings, we have new members of the committee here, about 9 of them that have not touched this issue before from this type of perspective. We also, I think it would have been helpful to have the respective opinions of other experts in the field. But I do want to express my appreciation to the chairman we've had good discussions. And I also, my sincere effort is somehow to take your position of abstinence and marry it with a pragmatic approach. And we're going to have these discussions today. I recognize, Mr. Chairman, that you seek to actually eliminate morbidity and mortality with regard to the use of tobacco products. But I believe to be pragmatic and realistic is that people are going to continue to use tobacco products. So how do we create the continuum of risk and make sure that people have the opportunity to make informed choices along that continuum of risk? So I believe the critical issue to be considered is how do we measurably and effectively reduce disease and death associated with tobacco use while products remain legal for over 40 million Americans and who have not, cannot, or perhaps will not quit. I believe keeping the American tobacco consumer and the public uninformed about the differences in the risk between smoking cigarettes and using non-burning forms of tobacco and other nicotine products is not in the best interest of our country. Telling current cigarette smokers to, quote, just say no, to quit now is not the most effective way to save thousands of lives. Creating a regulatory scheme that discourages or in fact chills the development of new lower risk products is directly opposite of what many in the scientific and public health communities advocate. But those are the underlying tenets of the mark presented by the chairman today. But what do the experts say about the legislation? I shared with the chairman and asked him to take a look at the Royal College of Physicians. They said that, quote, the current situation is perverse, unjust, and acts against the rights and best interests of smokers and the public health. Harm reduction has the potential to play a major part in preventing death and disability in millions of people who currently smoke and who either cannot or will not otherwise quit smoking. These smokers have the right to be able to obtain and choose from a full range of safer nicotine products. And that, in fact, is the goal of this continuum of risk and the discussion I'd like to have with the chairman, and I have amendments that will address that in this markup.
Thank you, Mr. Boyer. Your time has expired. Recognition on this side of the aisle. Who seeks recognition for an opening statement? Ms. Eshoo, the opening statement.
Just very briefly, Mr. Chairman, thank you for scheduling the markup of these bills. They're all important bills, and the American people will benefit from them, and they enjoy broad bipartisan support, which is so important. A bill that was supposed to be on but isn't was the Arthritis Prevention, Control, and Cure Act, and it was removed because of opposition from the Republicans. I think members will recall that last year the House passed the bill by unanimous consent. It enjoyed over 248 co-sponsors, some 70-some Republicans as co-sponsors. I want to thank you for your commitment to work with me to get this bill done. There are literally millions of Americans that suffer from arthritis. And I think something that's forgotten, and that is that children do. We have 7 states in our country that don't have even one pediatric rheumatologist in the entire state. And if children go undiagnosed, they have hell to pay for that in their adulthood. So I look forward to working with you to see this bill make its way not only through the House but the Senate and to the President's desk. Thank you.
Thank you very much, Ms. Eshoo. Mr. Deal?
Thank you, Mr. Chairman. I understand that most of the bills that will be presented are issues that have been presented to this committee before, but as pointed out by Mr. Bouyer, not everyone on the committee has gone through the full hearing process relating to them. My understanding, however, that several of the public health bills are reflective of bipartisan compromises passed by the House last Congress, while there are others that have been changed without the opportunity for members and the staff on both sides of the aisle to address these concerns. It's my hope that this markup will give us the opportunity to express those concerns in an open and fair debate. Many of you are aware of my efforts to improve health care price transparency for millions of uninsured and self-pay patients to ensure that patients and providers have the information they need to make the best choices. Knowing the price before selecting a health care provider is important. Patients have the right to know this information, particularly given the magnitude of our current economic environment. I also find it somewhat ironic that this committee is now considering H.R. 1256, the Family Smoking Prevention and Tobacco Control Act, given that it is less than a month ago that the Democrat majority passed an S-chip expansion bill that is depending on 23 million new smokers in order to fully pay for it. We've long been aware of the harmful and addictive effects of smoking, and I believe it is appropriate for us to look at ways to diminish the prevalence of smoking in our society. Smoking contributes to disease and death and imposes tremendous cost to our society as a whole. While I'm sympathetic to the objective which this legislation seeks, ensuring that cigarettes remain out of the hands of children and encouraging adult smokers to quit, the bill's quit or die mentality simply will not work for millions of Americans addicted to nicotine. I also have serious concerns with establishing a new regulatory responsibility under FDA at a time when members on both sides of the aisle agree that the agency is in dire need of resources to carry out its core mission of protecting the nation's supply of safe food, drugs, and medical devices. As you will recall, former FDA Commissioner Dr. von Eschenbach provided testimony during our hearing on the bill last Congress stating the agency would be forced to shift resources from these primary missions, especially after repeated instances of contaminated food and drugs being released into the marketplace. That is a dramatic step, in my opinion, in the wrong direction. I'm also concerned about false misrepresentations or misconceptions which this legislation could produce. The FDA is tasked with ensuring products under its review are safe for the American people. By mandating FDA regulation of tobacco, we will leave the public with the misconception that tobacco is safe. I think we all recognize that cigarettes are inherently harmful. That being the case, by granting cigarettes with an FDA seal of approval, this legislation will have the perverse effect of lowering the perceived risk of cigarettes. I don't believe that cigarettes will ever be safe. Therefore, it would be inappropriate for FDA to regulate such a product. As an appropriate alternative, I'm pleased to join Representative Bouyer and a number of my colleagues on both sides of the aisle in support of the Youth Prevention and Harm Reduction Act legislation, which accounts for the varying degree of risk among all types of tobacco products and would establish a new tobacco harm reduction center within the U.S. Department of Health and Human Services to regulate tobacco products without placing yet another burden on the FDA. I believe this is well-crafted legislation which would have the effect of reducing disease and death associated with tobacco use and thereby through prevention, cessation, and harm reduction. This legislation would take bold steps as well to improve health-related information on the effects of tobacco use and ensures stringent standards for review and approval of such products that are in place. I think that this is a sensible approach to reduce the number of adult smokers and to ensure our children do not start in the first place. Mr. Chairman, I thank you for your efforts in all of these measures, and I look forward to working cooperatively with you as we move through this markup today. I yield back my time.
Thank you very much, Mr. Deal. Mr. Dingell?
Mr. Chairman, thank you. I commend you for this markup today. We have a number of important bills before the committee. All these bills before us passed through this committee and passed the House overwhelmingly during the 110th Congress. So there's nothing new before us today. But then, as now, the Senate is the obstacle to getting these pieces of legislation enacted into law. It is also, of course, true that these legislations are the result of bipartisan deliberations. The arguments for and against have been heard by most of the members of the committee. The bills before us were not enacted, as I mentioned, because the Senate failed to enact them prior to the end of the 110th Congress. I am delighted, Mr. Chairman, that you have revisited these important pieces of legislation and that you are doing so quickly this session. And I want to applaud my colleagues for their continued persistence. We will hear today complaints that FDA does not have adequate resources to do a job, and that this is then an argument why we might not want to consider these pieces of legislation. Clearly, this is erroneous, and clearly this is unwise and wrong, because if the agency lacks resources, which happens to be the case, it is the responsibility of this committee then to see to it, first, that it has the resources, second, that it has the powers, and third, that it has the authority to address the concerns that the people have with regard to safety of matters under the jurisdiction of that committee. And I would point out that we have legislation in this committee at this time, which I and Mr. Stupak and Mr. Pallone co-sponsor, which would not only give authority, but which would give the financial resources to the Food and Drug Administration to do the job that it cannot and is not now doing. So we have two problems to address. Let us not cavil about one while we ignore the other. So, Mr. Chairman, I urge the favorable consideration of all of this legislation. As a matter of fact, it is so neatly done, and it has been so well handled in the committee during the previous session that we could almost consider it in block by unanimous consent, but I'm sure there'd be somebody who would object. Mr. Chairman, I yield back the balance of my time, and I urge my colleagues to support this legislation.
Thank you very much, Mr. Dingell. I should have asked unanimous consent, but we're already on track. Mr. Stearns, do you have an opening statement?
Good morning, and thank you, Mr. Chairman. Thank you for holding this hearing on a piece of legislation that will attempt to prevent, among other things, our young folks, young people, and the next generation from smoking by placing tobacco under the Food and Drug Administration. The FDA is a federal organization whose mission is to protect the public health by assuring the safety, efficacy, and security of human drugs, biological products, medical devices, and our nation's food supply. I was not supportive of this bill in the past, and I think there's a better alternative available, such as Mr. Boyer's bill, which will establish a new tobacco harm reduction center within the United States Department of Health and Human Services to regulate tobacco products. My colleague, Mr. Boyer's bill, will have a two-prong approach that will combine smoking cessation programs with harm reduction strategies and will not grant an FDA approval of cigarettes. I'm cautious of the capacity of the FDA to have both the necessary staff and the proper funding to carry out the complete regulation of tobacco products in every state, city, and town in America. This legislation will require the FDA to regulate product claims, advertising and marketing, control nicotine levels, and provide oversight to warning labels. Included in this bill is also a provision that will require the FDA to inspect every 2 years every facility that manufactures and processes tobacco at home and abroad. Now, obviously, this bill is going to be paid for through user fees collected from the tobacco companies. Mr. Chairman, I think the Boyer bill is a more practical approach to doing this. And I think as we look at the marketplace today, at this point, there's alternatives, and so I recommend my colleagues to look carefully at the Boyer bill. With that, I yield back the balance of my time.
Thank you, Mr. Stearns. Mr. Pallone.
Thank you, Mr. Chairman. We're marking up 10 very important public health bills today, and these various pieces of legislation represent our commitment to national public health priorities, like providing vision care for children, enhancing the primary care workforce, and protecting our children from the dangerous poisons found in tobacco products. These bills were passed with bipartisan support in the House during the 110th Congress, and I urge my colleagues once again to pass these vital pieces of legislation out of this committee with the same level of urgency and vigor. Let me just mention the tobacco bill. I don't want to use up all my time, Mr. Chairman, but I want to thank you for your tireless work on the tobacco legislation. Of course, it's the leading cause of preventable death in the United States. But it's not only dangerous to the individual, but also places a tremendous cost burden on our health care system. In President Obama's call for health care reform, he cited the need to use our resources wisely and efficiently. The cost to private and public payers are over $96 billion annually. Regulating tobacco products is a win-win for our nation's health and our need to be fiscally responsible in a time of economic hardship. And obviously, when you talk about prevention, that's a very important way in the health care reform debate to save money, to save costs, and to make sure that people live longer. The bill gives the FDA the authority to regulate tobacco products and restrict tobacco marketing, but especially from our most vulnerable and impressionable population, our children. So I'm proud to be a co-sponsor of this bill, along with many of my colleagues on the committee. I'm not going to talk about the other bills. I just want to make sure that we move them quickly. I know that my feeling is that because we had hearings and we had the action in the subcommittee and the full committee last session, that we can bring them to the full committee today the way we are and get them passed quickly and over to the Senate. And I hope that the Senate this time does pass the bills and they end up on the President's desk for his signature as soon as possible. Thank you, Mr. Chairman.
Thank you, Mr. Pallone. Mr. Barton.
Thank you, Mr. Chairman. Appreciate you recognizing me. Today we're going to consider a number of bills, the most important and controversial of which is the Family Smoking Prevention and Tobacco Control Act, which is a bill that you have personally introduced for a number of Congresses. Regarding that particular bill, I will say today what I said during last year's markup of what is basically the same bill. The FDA is the wrong agency at the wrong time to give this type of responsibility. As we all know, the FDA's primary responsibility is ensuring the safety of our drugs and our food in the United States. It approves food, drugs, and medical devices based on safety and efficacy. This legislation would give the FDA a new job, require it to take on something that is both enormous, completely outside its regulatory experience, and I think will divert attention from its core mission. Since last year's markup, as you very well know, we have witnessed salmonella outbreaks in both peanut butter and peppers. We've heard criticism from both sides of the aisle. The FDA is not adequately staffed to handle its current responsibilities. Several members of Congress have gone so far as introducing legislation to split the FDA into two separate agencies because they claim the agency is not placing the appropriate attention on food safety. A previous commissioner of the FDA, in testimony provided to this committee, stated that the agency, that is the FDA, is not the proper place for this type of responsibility, and that placing this type of regulatory authority at the FDA will divert resources from other critical areas. That seems to be, to my opinion, self-evident. There are better ways to address the issue of tobacco, and I would hope as the bill moves forward, members will reflect on the unintended consequences. Mr. Bouyer is going to offer what amounts to an amendment in the nature of a substitute, and I think it is worthy of some consideration. I'm also disappointed about the process on this particular bill. I know that it passed the House in a form very similar to this last year on the suspension calendar, and I will admit that it's probably going to do so again this year. But we have a number of new members on the committee, especially on the majority side of the aisle, and I'm not aware of any special deadline or pressing reason to bypass regular order, which would and should include a hearing and perhaps even, wonder of wonders, a subcommittee markup. Lots of people are beginning to talk about the good old days when we actually had regular order, and I think there's some value in going back to it. The absence of regular order does a disservice to the members of the committee, especially the new members of the committee, and the people that they represent, because they've not had a chance to review the issues like some of the grizzled veterans like yourself and myself. Now, a few words about the 9 public health bills. First, the good news. They are bipartisan. I think a third of the bills are offered primarily by minority members, and I appreciate you, Mr. Chairman, for including those bills in the markup. It's a good thing when we work in a bipartisan manner. So I will say, though, that some of the bills that we're considering today, while they have passed the committee in similar form, have been changed, and I believe the bills that have been changed, it would have been nice to have had a hearing at subcommittee so we could get an idea of the consequences of those changes. We have been working at the staff level to resolve some of the issues that have been addressed, have been brought up because the bills have been changed, and I will say, Mr. Chairman, that the majority staff has worked in good faith with the minority staff. The more we do that, the better the process, the better the product is going to be. Let me comment very briefly on each of those 9 bills. H.R. 756, the National Pain Care Policy Act, enhances awareness of chronic pain with providers and the community. Chronic pain is an issue that many people suffer from. This bill would create an interagency coordinating committee to coordinate all the efforts within HHS and other federal agencies related to pain research. This effort, along with the efforts at the NIH via the Pain Consortium, will go a long way towards increasing research and awareness of chronic pain. H.R. 914, the Physician Workforce Enhancement Act of 2009, would assist small hospitals that serve rural or growing areas by providing them with the resources to establish a residency training program for certain high-need medical specialties. H.R. 20, the Melanie Blocker Stokes Mom's Opportunity to Access Health Education Research and Support for Postpartum Depression Act, is a bill in itself, just in the naming of the act, Mr. Chairman. This one is from Representative Rush of Chicago, and I think it is a much-needed addition to our current law in this area. H.R. 577, I realize I've got 3 more, Mr. Chairman, and then I'll be quiet. The Vision Care Act of 2009 would ensure that children, especially low-income children, have access to vision screenings. We support this bill. H.R. 479, the Wakefield Act, reauthorizes the Emergency Medical Services for Children Act. This program seeks to ensure that hospital emergency departments have the ability to care for their young patients just as they do for their adult patients. We support this act also. The Early Hearing and Detection Intervention Act reauthorizes the newborn and infant screening program. I think this is a very important program, and we support that. H.R. 307, the Christopher and Dana Reeve Paralysis Act, delves into the issue of paralysis. This bill would authorize funding research on paralysis and research focusing on enhancing daily functions for persons with paralysis. We support the concept, but I believe this could be done within the NIH. There's 2 more bills, but we'll just simply say that we support H.R. 1253 and the Dextromethorphan Distribution Act of 2009, introduced by Congressman Upton.
Thank you, Mr. Barton.
Thank you.
Mr. Green.
Thank you, Mr. Chairman. I know we have a minute, and I won't take my whole minute. I want to thank you for including the Vision Care for Kids Act, and I have a full statement I'd like to place in the record. This passed the House bipartisanly, as our ranking member said, and there's no opposition from the minority side, but that we would be able to pass it today. And with that, Mr. Chairman, I'll yield back my time.
I'm not either.
Without objection, gentleman's statement will be put in the record. Mr. Upton, did you wish to be recognized?
Ready to get to markup, so I yield.
Okay. Other members that wish to be recognized? Gentleman from Michigan.
Thank you, Mr. Chairman. I'd like to speak in support of H.R. 756 today, the National Pain Care Policy Act. I appreciate the efforts of both the majority and minority to bring this legislation to a markup. Identical legislation was passed by this committee and the full House last year, and it reflects a bipartisan compromise developed by Mr. Dingell, Mr. Barton, Ms. Capps, and I want to thank all of them for their work on this bill. This year, I again joined with Ms. Capps to introduce bipartisan legislation strengthening pain research at the NIH. I'd like to thank my colleague for her dedication to this issue. Chronic pain continues to be a major public health problem in the United States, and it still is the single most common reason people seek medical care. Chronic pain continues to be a major, unfortunately, patients continue to struggle through a maze of uncertainty, often having to see countless specialists before finding someone who can properly treat chronic pain. Pain accompanies a wide range of clinical conditions, including cancer, diabetes, arthritis, and HIV. Yet NIH spends less than 1% of its research budget on all types of pain. The legislation we will mark up today improves education on chronic pain, helps patients with access to pain care, and strengthens pain research at the NIH. It is certainly a culmination of 8 years of work I have spent on this very important issue. And again, I want to thank Ms. Capps for her efforts to bring this bill forward today. And I really appreciate your dedication on this very important public health issue. Thank you, Mr. Chairman, and Mr. Barton, for your willingness to work with us on this bill. And, Mr. Chairman, I'd also like, if I may, to put in the record a letter of support from 120 health organizations from across the country involved in chronic pain research, education, and treatment. And with that, Mr. Chairman, I would yield back the remainder of my time.
Without objection, the letter will be added to the record following the gentleman's opening statement. Mr. Gett.
Thank you, Mr. Chairman. I also will put my full statement in the record, and I just want to commend you for your years of work on this tobacco issue. It shows a real dedication to the health of not just our children, but of all Americans. And so I think it's one of those things when you ask the people out in the real world, should the FDA regulate tobacco, they think it's already done. And so they would be very, very supportive of this. And the other thing I'll say, Mr. Chairman, I really look forward to working with you as we move along to find better ways to target advertising directed to teen smokers and to make sure that we can remove that very, very big threat. As we all know, the studies show that if you can stop somebody from smoking when they're a teenager, you can really reduce smoking in general in this country. And I yield back the balance of my time.
Thank you very much, Mr. Gett. Mr. Pitt.
Thank you, Mr. Chairman, for scheduling the markup on several important bills dealing with very important issues, including, I want to highlight H.R. 20, the Postpartum Depression Research and Care Act. I support continued research on postpartum depression. I'm glad to see this legislation move forward. I also support research on the emotional effects of pregnancy outcomes, such as carrying a pregnancy to term and placing the child for adoption or miscarriage or even having an abortion. It is important that we learn more about the effects of abortion in order to provide women with the care they need. Because of the lack of research and information, post-abortion depression goes widely unrecognized and untreated. Women deserve to know the long-term effects of abortion on their mental and emotional well-being, and women who've had abortions deserve to have mental health professionals who acknowledge the emotional impact of this and have the tools to treat it. And I believe that increased research on post-abortion depression will lead to a greater awareness of this issue and the development of compassionate outreach and counseling programs to help post-abortive women. And I'm pleased that this bill includes a provision that expresses the sense of Congress that NIH may conduct a longitudinal study of the long-term mental health consequences of various pregnancy outcomes for women, including abortion. I'm hopeful that NIH will pursue this recommendation. I want to thank Mr. Rush for working with me through the years to include this language in this important bill, and I thank him for his commitment to helping women who suffer from various types of depression. Thank you, Mr. Chairman. I yield back.
Thank you, Mr. Pitts. Ms. Capps?
Mr. Chairman, I want to commend you for bringing these several pieces of legislation up for swift action. Hopefully, unlike last Congress, we will see the Senate finally act on these important measures. I'm especially pleased to see that two pieces of bipartisan legislation I've worked on are being considered here today. The first is the Early Hearing Detection and Intervention Act, which I introduced with Joanne Emerson this year. This bill will ensure the success of the newborn hearing screening program that it is built upon so that all children will receive any necessary follow-up care. The other bill has been mentioned already by my colleague Mike Rogers, the National Pain Care Policy Act, and he and I have worked hard on this, and I want to return the compliment and thank him for his tireless work to ensure that we had a good bipartisan compromise. The bill will improve coordination of pain care and facilitate better sharing of information about pain across the many health disciplines. Both of these bills are supported by, as he has mentioned, a broad coalition of health professionals, patients, biotechnology firms, and researchers. I hope I can count on the support of all of us today here so that we can see these bills signed into law soon, and I yield back.
Thank you very much, Ms. Capps. I think the Ms. Blackburn, do you wish to be recognized? Okay, then Mr. Gingrey.
Mr. Chairman, thank you. Mr. Chairman, I want to congratulate you for your work on this important issue, and I realize that work goes back at least 10 years. I'm one of the new members of this committee and missed a lot of the hearings, but understand the importance of this issue, especially in trying to stop new smoking. Our youth and our teenagers, I think that's extremely important. Having said that, though, I don't plan on voting for your bill because I think there is a better plan, and that's the amendment in the nature of a substitute that Mr. Bouyer is going to present, the Youth Prevention Tobacco Harm Reduction Act. Mr. Chairman, the Family Smoking Prevention and Tobacco Control Act would add the regulation of tobacco and tobacco products to an already long list of FDA oversight responsibilities. Human and veterinary drugs, biological products, medical devices, our nation's food supply, cosmetics, and products that emit radiation. Over the past 2 years, this committee has held numerous hearings highlighting the failure of the FDA to carry out its current responsibilities. And most recently, and I was at that hearing, in my home state of Georgia, a breakdown in FDA oversight partially contributed to the distribution of salmonella-tainted peanut products, which sickened more than 677 people in 45 states and caused at least 9 deaths. Mr. Chairman, this committee should heed the warnings of the past. People understand the dangers of tobacco. What they don't understand is why a child should die from eating a peanut butter and jelly sandwich. We need to keep the FDA focused first and foremost on products that should be safe. And with that, Mr. Chairman, I'll yield back, and I thank you.
Thank you very much. Mrs. Harman.
Thank you, Mr. Chairman. I believe we're going to adjourn for the Gordon Brown event. I'm not sure of that.
Well,
so I
if the gentlelady will permit, I won't take away her time, but for the scheduling of the members, we will stay here, and those who want to give opening statements, we will continue with the opening statements. Then we will recess until 1 o'clock to continue the actual markup on the legislation. If members want to go to the floor and still do an opening statement, let us know, and we'll provide an opportunity for that. Certainly the record without objection will be held open for all opening statements by members so that you'll have your opening statement in the record even if not delivered orally. But if you wish to give an opening statement and are willing to stay here, we're willing to recognize you. Okay,
Well,
Ms. Harman.
Reclaiming my time, and I hope there it goes. I want to thank you for accommodating members, including me, and commend you especially for your work, your personal work on this FDA tobacco regulation bill, which I think is a hallmark of your career and certainly very personally important to me. I only wish it had passed when you came to Congress in 1974 because it might have saved the lives of both my parents who died of lung cancer from smoking. In one of the earlier comments this morning, Mr. Chairman, I think I heard a member of this committee say that this bill undermines the revenue stream for S-chip. I believe that was the comment, and I just want to observe as a fairly long-standing member of this committee that I think that's colossally cynical and disturbing, and disassociate myself from that comment. Let me just close with the observation that this week, as we act on this legislation, thousands of Americans will die from tobacco-related diseases, and thousands more will become new regular users. Approximately 4,000 children try a cigarette for the first time each day, and this cycle needs to be broken. I believe the FDA, as you said, is best qualified to enter this arena and will provide the nuanced regulation that is so necessary. I'm very pleased to support this legislation again, and on behalf of my 3 grandchildren who are under 3 and therefore have not had the opportunity to smoke yet, I thank you profoundly and yield back.
Thank you, Mr. Harmon. Mr. Scalise? Do you wish
Thank the Chairman. Yeah, I know we've got a number of bills on our agenda with the time constraint that we're dealing with. I'll specifically address my comments to H.R. 1256. And I know a few things have been said about the alternative bill that's going to be filed, the substitute by Congressman Booyer, and I think they've said some good comments about that. I think my concerns mostly revolve around the mixed messages that I think this bill would ultimately be sending by giving this FDA sanctioning to a product that many have pointed out is a harmful product, and by having that, whatever regulations they're going to try to put in place, at some point in time it's going to become recognized by the public that tobacco products are in essence sanctioned by the FDA, and the things that go along with that I think don't necessarily reflect the goals that this committee might be trying to achieve. So I do think that's one concern that is going to become a bigger problem down the road. I think most people are very familiar with the Surgeon General warning, not really sure what we'll see in terms of advertising, or at least in the public's perception, once FDA becomes the sanctioning body for tobacco products. There's another concern in this bill. It does give legislative ability for the FDA to transfer funds as they're starting up this new tobacco center. They can actually take money away from other parts of the FDA to move it over to set up this new agency, and as many people have pointed out, they already have shortfalls as they're trying to bring new drugs to market, make sure that our drug supply is safe. I'm real concerned that for at least a 6-month period of time, they'll be able to take money away from those agencies that are already strapped and backlogged and move them over to creating this new entity dealing with tobacco. So it will take the FDA's approval ability and their sanctioning ability away from some other areas that are their primary mission. And so with those, I'll yield back the balance of my time.
Thank you very much. Ms. Baldwin.
Thank you, Mr. Chairman. I appreciate the fact that you're bringing forward so many of these critical public health bills for consideration today. I would like to highlight just one of them. Later today, we will be considering a bill that I co-sponsor with my friend and colleague, Congresswoman Mary Bono Mack, and that's the Christopher and Dana Reeve Paralysis Act. This bill passed the House with strong bipartisan support last session, and we are both looking forward to it becoming law in this Congress. I was fortunate enough to know Christopher and Dana Reeve, and I think I fairly speak for my colleague, Mrs. Bono Mack, when I say how inspired I know Mary was by Dana Reeve's experience. Christopher and Dana were 2 individuals who proved that sometimes the greatest hardships are the starting point for incredible advocacy. Christopher and Dana Reeve, the Paralysis Act reflects our desire to carry on their work on behalf of people living with paralysis. The bill expands research on paralysis at the NIH by encouraging increased collaboration as well as attention to the daily functioning of people with paralysis and other physical disabilities. This bill also supports programs that will improve the quality of life and health of persons with paralysis across the country. Christopher and Dana Reeve used their visibility to work on behalf of families in all parts of this country who face the challenges of paralysis and impaired mobility. I've been honored to carry on this work, and I'm honored to work on this legislation with my colleague, Congresswoman Bono Mack, as well as Congressman Langevin and Congressman Bill Rackus. I urge all of my colleagues on the committee to join me in supporting this legislation. And again, thank you, Mr. Chairman.
Thank you very much, Ms. Baldwin. Mr. Butterfield?
Thank you very much, Mr. Chairman. I, too, would like to thank you for convening this very important hearing today. I know you've waited a very long time for this day. Mr. Chairman, what you and others may not know is that I represent the largest tobacco-producing district in the United States of America. I also have a district that the poverty level for children under the age of 5 is in excess of 30%. I also have a district that is very high in the incidence of smoking. And so I find myself in a very precarious situation. But I want you to know, Mr. Chairman, and my colleagues to know that I am prepared to enthusiastically support this legislation. But with that said, I need to remind all of you that the tobacco industry has changed. Just as everything else in America has changed, the tobacco industry has changed dramatically in the past 20 years. It has changed for growers, for buyers, for manufacturers, but notwithstanding, I will certainly be supporting this bill because it has good policy objectives. It is my sincere hope that the FDA will use its power, as we used to say when I was a judge, judiciously, so that the modern tobacco farmer who uses the state-of-the-art technology, one who uses the best practices and hard-earned wisdom to grow their crop, that they may be allowed to continue to earn a living just as we all earn our living, so that they can support their families and their communities. Thank you, Mr. Chairman, for good work on this legislation. I intend to support it. I yield back.
Thank you very much, Mr. Butterfield. Ms. Christensen.
Thank you, Mr. Chairman. This promises to be a good day for the public's health in this country. The 10 bills we're marking up today fill in long-standing gaps in our system. They increase prevention, especially in our children. They expand access to important services, and they go a long way to providing the protections that we need and expect our government to provide. I applaud all of the sponsors of the legislation before us today, but I especially want to applaud the Family Smoking Prevention and Tobacco Control Act, which contains the strongest standard for product regulation ever given to the FDA and will help to save millions of lives. I know firsthand how difficult it was to get the support needed to pass it last year, but that was after many, many years of hard work by you, Mr. Chairman, and many organizations like Tobacco Free Kids. I particularly want to join my colleagues in singling you out, Chairman Waxman, and to congratulate you and thank you for your determination, your leadership, and for being willing to look at and work with both sides throughout this effort. I look forward to continuing to support this bill and towards its passage, towards the President's signature, and especially now that we have an administration that we know we can count on to implement it as it was intended. With that, I yield back the balance of my time, Mr. Chairman.
Thank you very much, Ms. Christensen. Ms. Sutton.
Thank you, Mr. Chairman. Thank you for holding this hearing, this markup on these bills. The list of health-related bills before us are important steps in addressing health care in our country. And I am a co-sponsor of many of these bills and look forward to continuing my support on these initiatives. However, today I would just like to highlight, as others have here, the Family Smoking Prevention and Tobacco Control Act, Mr. Chairman, that you have put so much work into. We all know that tobacco use in our country is a serious public health issue, and the Campaign for Tobacco-Free Kids estimates that 18,500 adults in Ohio die every year as a result of smoking. Even more shocking is that an estimated 293,000 kids in Ohio under the age of 18 will die prematurely from smoking. Mr. Chairman, tobacco results in more deaths than alcohol, AIDS, car accidents, illegal drugs, murders, and suicides combined. And the cost to our society does not stop with the tragic loss of life and promise. In Ohio, annual health care costs directly caused by smoking are at $4.37 billion. The portion covered by the state Medicaid program, $1.4 billion. Residents' state and federal tax burden from smoking-caused government expenditures is at $629 per household, and smoking-caused productivity losses in Ohio, $4.65 billion. So clearly the need is urgent, both on a health-related aspect as well as it makes good economic sense. Thank you, Mr. Chairman.
Thank you very much, Ms. Sutton. That concludes the opening statements on the legislation before us. We will now recess until 1 o'clock, and we will reconvene with the markup.